Hello, Mr. Leon. My name is Cynthia. I'm going to be the nurse for the day. I just need to verify your name and your date of birth, please.
My name is Brian Leon.
Mm-hmm.
Birthday is April 23rd,
Okay.
1985.
Perfect. So we're going to be doing a head, eyes, ears, nose, and throat assessment on you today.
Okay.
The first thing we're going to do is actually ask you a couple of questions about your previous health history and your medical history, about your head and your neck, and then we will work down through the systems. So I just have a couple of questions to ask you. Thank you. Have you had any head, skull surgery, or facial fractures in the past?
None.
Good. Any headaches?
No.
Any swelling of the face?
No.
Sinus infection or tenderness?
No.
Do you suffer from nasal discharge, postnasal drip?
No.
Any nosebleeds?
No.
Any mouth lesions, ulcers, or cold sores?
No.
Any difficulty swallowing or chewing?
No.
Any changes in sound of voice?
No.
Any allergies causing difficulty breathing?
No.
Any neck injury or surgery?
No.
Good. Okay, so now we're going to do the physical assessment of your head and your neck, and I will start by looking at your hair and your scalp for the inspection. Okay, so during this I'm gonna actually look at your hair, look at the quality, look at the texture, look at the distribution of your hair, make sure it's even, there's no hair loss. Also look to see if there's any presence of nits, and your hair is intact, it's good distribution. Next part we're going to do is do the skull inspection and palpation. So we're just going to look at the general size and contour of your head and your skull. It's symmetrical. I'm going to now actually go around and feel in your hair to make sure you don't have any tenderness, any lesions, any painful areas. So as I'm touching, just let me know if anything is giving you discomfort. So just let me know. Everything's okay? No pain, no discomfort? No. I don't feel any masses, no lesions, so it is good. Also, we're going to palpate the areas and check for the temporal artery. Good. And we also will check to see for any TMJ. So I'm going to ask you to open your jaw, close, open, close. Good. Okay. Next part that we also are going to do is do a facial inspection. Okay. And what I'm going to just do right now is just look for facial expressions. So can you please smile for me? Good. Show me your teeth. Can you stick out your tongue? Perfect. And your face is symmetric. Again, we're going to look for any involuntary movements such as tics. There's no edema. There's no lesions on your face. Your color and your texture of your face are good, even. There's no rashes either. So now we will be doing the neck inspection. Okay, so we will be making sure that your face is symmetrical. Your neck is symmetrical. So the next thing we'll be doing is to make sure that you have range of motion. So can you please move your head to the right? Perfect. To the left. Okay. Tilt it forward. Tilt it backward. Good. So, perfect. Alright. Next step that we want to do with your head, with your neck, is also we want to look, can you tilt your head back? We want to see if there's any presence of JVD, which is jugular vein distension. So no jugular vein distension here. And we will also feel for the carotid arteries. Good. Perfect. And we're going to palpate the thyroid gland. Perfect. So there's no lesions. And what I need you to do is tilt your head back. Take a sip of water for me. Hold it. Don't swallow. Tilt your head back and swallow. Good. So ensuring that. Okay. Now, do it one more time. Small sip. Okay. Tilt your head back again. And we're going to Good. Swallow. Good. Perfect. All right. Now we're also going to assess for the lymph nodes. So just going around, palpating, feeling, make sure there's no masses, no nodules as we're checking. No deviations present. Very good. Okay. Again, so now we're going to auscultate. So we want to make sure that I'm hearing your carotid arteries. We want to make sure there's no bruits, no deviation from the norm. So I will be listening to your carotids. Good. Good. And also I will be auscultating your temporal arteries also. Good. Good. Perfect. So now we will start, now that we're done with this area, actually, so we will be doing, I need you to close your eyes for me, and I am going to touch you with a soft or dull, soft or sharp area, and you just, around your face, just please tell me what sensation you feel, if it's soft or if it's sharp, and what area of the face location you felt it at. So if you could please close your eyes for me.
Soft forehead.
Good.
Sharp right cheek.
Good.
Soft chin.
Good.
Sharp right cheek.
Good. Perfect. Okay. So after we're done with that, we're going to start with your eyes. Okay. So I'm just going to again ask you a couple of medical and medical questions, history questions about your eyes. So I need to know just a couple information from you. So, do you wear any corrective lenses?
No.
So no glasses or contacts?
No.
Do you have blurred vision?
No.
Do you have any spots or floaters, halos
No.
around lights? Good. Frequent or eye infections, inflammation?
No.
Good. Have you had any eye surgery or injury?
No.
Okay. Any styes?
No.
Do you have a history of high blood pressure or diabetes?
No.
Good. Any prescription medications for your eyes?
None.
Family history, such as cataracts, glaucoma, or blindness?
Not that I know of.
Okay. And also, when was your last eye exam?
About 3 months ago.
3 months ago. Perfect. So I'm just going to cut that down. Okay. 3 months ago. Okay. So when we're looking at your eyes, we just want to, first again, we're always going to inspect first. So we just want to make sure there's no edema around the eyes. If you want to close your eyelids, make sure they're even, make sure they're contoured, make sure everything is symmetrical again. Eyebrows are intact, eyelashes are there, there's no edema present, no lesions, no masses, and we're going to look at, please bring your head up a little, thank you. We're just going to make sure here around the eyes, again, no edema, and we're going to look at the sclera, make sure that it's clear, look at the eyes, the iris, make sure the colors are patent brown eyes, and also we're going to check to make sure that your eyes adjust to the light. So I'm going to check your pupil reaction. Okay. Come in. Just look straight ahead. Good. Constrict. Good. So they accommodate to light. Perfect. Alright. So another thing that we need to do is I need you to follow my fingers. So good. Perfect. So another important measure of eye vision would be the Snellen chart. Fortunately, we don't have the Snellen chart here, but if we do, you would be 20 feet away from the chart, and you would read the letters with both eyes, with one eye, with your right eye covered, exposing the left eye, reading the letters with your left, then covering your left eye and reading the letters with your right. Okay, and it will tell us how your vision is. If it's 20/20, from 20 feet away, 20/30, 20/40, etc. Okay. The next set of questions we're going to ask are about your ears. Okay.
Okay.
And do you have any hearing differences in one or both ears?
No.
Good. Any pain in the ear?
No.
Good. Any trouble with earwax?
No.
Okay. Any ear injury or ear surgery?
No.
Do you have ringing or crackling in your ears?
No.
Any foreign body in your ears?
No.
Do you have frequent ear infections and drainage?
None.
Problems with balance, vertigo, or dizziness?
None.
Do you take over-the-counter meds or remedies for your ears? No.
No.
Does anyone in your family have a history of hearing problems?
Not that I know.
Okay, perfect. So the first thing we're going to do is we're going to actually look at your pinna. So we're going to look at your pinna. We want to look at the size. We want to look at the shape. Again, we just want to make sure it contours, it's symmetrical. Also, we want to make sure that if it's flat or protruding. And then we're going to look at your inner ear. Again, and we want to make sure there's no discharge, no drainage, no infection going on, earwax, anything of that nature. And we're going to look at both. So again, look at the pinna, look at the inner ear, make sure there's no drainage, no discharge. Again, we're just going to check, and we'll do a hearing test. So I'm going to stand right about here. I'm going to whisper a word to you, and I want you to repeat back to me what you heard. Okay? So you want to close your eyes so you don't have to see my lips.
Watch.
Good. So that's so you have good hearing. Next part we will be doing is your nose, throat, and mouth. Again, so we're going to inspect your nose. We want to look at your nose. We want to make sure that's symmetrical. It's going to tilt your head back a little bit. We want to look at the nares. We want to make sure that they're patent. There's no discharge, no lesions again, no issues. Do you have trouble breathing through your nose?
No.
No nosebleeds, correct? Okay, so we just want to make sure that it's symmetrical, that it's even, and patency for the nose. Okay? Again, for the mouth and throat, we want to ensure, so we're going to look at your lips, make sure they're pink and moist. Want to open your mouth for me? We're going to look at your teeth, make sure they're even. Make sure no cavities, no chips, tooth, or anything. Also, we're going to look at the tongue and the throat. We're going to look at the uvula. So I'm going to say, so you can say ah.
Ah.
Good. Ah.
Ah.
Perfect. And we're going to look at the ducts, and then just ensure that everything is okay. This ah.
Ah.
And perfect. Your teeth are all there, which is perfectly fine. So we are complete with the exam. I'm just going to give you some information here. Just going over what we did today. And if you have any questions, please feel free to ask. And again, we're just going to go, it's very important for you to have your yearly hearing exam. Again, like you said, you had your last eye exam 3 months ago, which is good. You should have a yearly eye exam also.
Okay.
And just here's some information for you regarding what we did today, and thank you.
Thank you.